Um, yes, so it's time to start. We have Hosseini, the chairwoman of the board of PAYA, who's going to start our event tonight. Thank you for joining us.
Thank you very much, Ali John. Good evening, everyone, and welcome to our virtual panel discussion on COVID-19 crisis in Iran. My name is HUREC Hosseini, board chair of the Public Affairs Alliance of Iranian Americans, PAYA. In this season of isolation, PAYA is hard at work bringing our community together to better serve us. Through PAYA's Iranian Americans Care campaign, we proudly highlight the brave contributions of our fellow Iranian Americans as the front lines of the fight against the COVID-19 crisis. Through our advocacy arm, we have asked the administration to facilitate the delivery of critical humanitarian assistance to Iran. And last but not least, we have worked tirelessly to initiate and secure an unprecedented coalition of Iranian American non-profit organizations to maximize capacity for effective emergency response to the devastating COVID-19 crisis in Iran. I know we all deeply care about the people of Iran. What we have achieved here together is a unified, empowered, collective effort under the umbrella of the Humanitarian Relief Coalition to act quickly and cover all bases as we lose increasing number of Iranians every day to coronavirus. With a crisis of this scale, we all wonder, what can I do? Iranian Americans reach out to us every day asking, how can we help? While the details of this fast-changing global crisis are hard to grasp, the path is clear. Now is the time for leadership and action, for common cause and common effort. I want to thank the leadership, staff members of Moms Against Poverty, Keep Children in School, the Iranian American Medical Association, Institute for International Health and Education, and our own team members, the Public Affairs Alliance of Iranian Americans, for your dedication and hard work, and to the many other organizations who have joined this effort in support. At this time, I'd like to introduce PAYA's Legislative Counsel, Ali Rahnama, who is moderating tonight's discussion. Thank you, everyone, for joining, and Ali John, you're on.
Thank you, Farouk Jan. Appreciate the introduction. I want to welcome all of you to our virtual panel on humanitarian relief efforts in response to the COVID-19 crisis in Iran. We're here with a panel of leading experts who will talk about the challenges and proposed solutions to battle the effects of COVID-19 in Iran. Our experts today will provide you an on-the-ground assessment of the COVID-19 situation in Iran. We will discuss the effects of US sanctions on humanitarian goods reaching the people of Iran. We look ahead at the future of Iran post-COVID-19. And finally, we will talk to you about the newly formed Humanitarian Relief Coalition, or HUREC, and how it is responding to this crisis. Now, let me give you some good news before we get to the issue at hand. Our coalition has already grown to 20 organizations in the United States and counting. More organizations are joining us every day. And we're at the same time talking with some other organizations in Canada and United Kingdom to join us, which we think would be over 15 organizations. So we're starting tonight with the great news of unity coming from our community and Iranian diaspora organizations. Most of all of our members who have joined these coalitions in the United States are charitable nonprofits. And because of that, I want to make sure that everyone understands that this coalition that has been created is created with causes to provide for charity. And there are a lot of money that comes in are tax deductible. And anything that goes through us will not have any overhead. That I want to answer that question up front. But before getting into any detail, I want to introduce our panelists to you. First, I want to introduce Ms. Delphari Fanayi, who's founder of Moms Against Poverty. She's a compassionate humanitarian and advocate of children all over the world, fulfilling her lifelong vision to extend a helping hand in the start of poverty in 2008. Next, I want to introduce to you Ms. Gila Kashef, who is the founder and president of Keep Children in School, or KCIS. Gila has served as a volunteer and later a board member of Iranian Children's Rights Society, based in Los Angeles for several years. She started her humanitarian activity when she was forced to work at a very early age, and started her first job at the Centers for School of Social Work established by Ms. Setare Farmoyan in Iran. And that experience has always stayed with her. And now we see her starting a very big organization with great impact, Keep Children in School, and leading it. Next, I want to introduce to you Dr. Hossein Shukuh Amiri, who is the president of the Iranian American Medical Association, or YAMA. He is the surgical director of liver transplantation and serves as at the medical director of Louisiana Organ Procurement Association and the president of John C. McDonald Surgical Society. Dr. Amiri developed a portoenteric technique for pancreas transplantation in 1990, and his technique has been used worldwide. He's an expert doctor, which we all look up to when we want to work together. And and also I wanted to introduce to you Mr. Kamyar Alaei, who is the co-founder and co-president of the Institute for International Health and Education. He's an expert on HIV, AIDS, drug policy, and international health and human rights. He has an extensive experience in both global health policy and international human rights law. He has received many recognitions for his years of work, and he's also one of the recognized, he was awarded the Ellis Island Medal of Honor recently, which we congratulate him for that. And last, I want to introduce to you Mr. Eric Ferrari. He's the founder and principal attorney of Ferrari and Associates. Mr. Ferrari represents US and foreign corporations, financial institutions, exporters, insurers, as well as private individuals in trade compliance, regulatory licensing matters, and federal investigation and prosecutions. He's going to be our leading expert on US sanctions law, and we're going to talk to him about that in a few minutes. Now, before I start getting into our different segments, I wanted to go through one by one of our panelists and ask them to introduce their organizations for you in briefly. I will start with the same way. Ms. Delphari, I would like you to talk to us about Moms Against Poverty. Delphari, John, I think you're mute. It would be great if you could unmute yourself.
I was. I am sorry. Hello, everyone.
All right.
Go
ahead, please.
Since 2008, we have worked with underprivileged communities to empower them through our programs. which are, hunger relief and basic provisions, with the orphan cares, education, and health and wellness. We have managed to impact the lives of more than 300,000 children and the underprivileged communities in 14 countries, in Iran, especially in Iran and the US. I'll give you some of the examples of our work. We have built more than 45 schools. We have established about 82 village schools throughout Iran, in the underprivileged areas in Iran. We have managed to build libraries and orphanages and so on and so on. Since 2012, we have started working with the relief work. It started after the Azerbaijan earthquake. And what we did since, we were in forefront of every major disaster that has hit Iran. We have tried our best to bring relief and comfort to the people in these difficult times. We never, ever, ever imagined a disaster like Corona, pandemic, we will be faced with something like that. This is the most major one that we have ever been faced with. And the need is great. Thank you.
I think I forgot to unmute myself. Thank you, Delkhaib-jan. Next, I wanted to go to Ms. Kashif. Gila-jan, if you could give us a brief about your organization and your experience in your work in Iran. Thank you.
Sure. I would like to first express how privileged I feel to be here among all of you, and also to present our organization's cause to our audience and donors. Keep Children School Foundation actually was registered in 2010 in the state of California, the status of 501c3, and we obtained our OFAC license in 2012. At the same time, we actually established another organization in Iran. It's called, our operational arm, it's called Anjumani Yaran Danish va Mehr in Tehran. The main mission of the Keep Children School Foundation, as you mentioned, that I come from a family that I was forced to work when I was very young, to be part of the young and small breadwinner of the family. So I know the pain. I knew the pain of the children. That's why we started supporting children's education. And our mission was actually only education at the beginning, individual sponsorship. We match a student to our donors, and I'm sure there are thousands of them around that. Hopefully they are actually watching our webinar tonight. Sponsoring individual children was the main goal. However, after a while, we realized we have to go further. So we started creating group projects. But the group projects meaning that we do connect to the NGOs in Iran that they are very specialized in different areas of supporting children from impoverished families and actually impoverished provinces like Sistan Baluchistan, Lorestan, Kurdistan, Kermanshah, and impoverished area of Tehran like Iran, like Tehran, yes, Pakdash, Varami, you name it. I mean, there are endless areas that we can name. And we actually support the NGOs. We make a contract with them. We make an MOU with them as well. And to make sure that they provide all the services that they promised us to the many children. Some of them have 500 to 600, 700 children actually in their organization. This is the best way we expand our services to more children and individually.
Thank you, Gila-jan. We'll get more time on speaking how your services have been very effective and helpful in Iran in a few minutes. I wanted to move to Dr. Shukuh Amiri, give him a time to speak about Iran American Medical Association as well.
Thank you, Ali John, for arranging this webinar. Iranian American Medical Association was established 27 years ago. It's a humanitarian organization, non-for-profit, non-political, and non-religious. This organization has carried many humanitarian functions both in Iran and in the United States for Iranians, and also those who need any help. Among the function that we have had in Iran, we have been collaborating intensively with the established transplant programs in Iran, in Shiraz, and we have tried to bring it to other provinces of Iran, like Khorasan, like Tabriz, Azerbaijan, Kerman, and also some in Tehran. And some of the transplant activity that has not been so routine in Iran, we are collaborating to bring it to the country so everybody can use those. Also, in other problems that have been faced in Iran, like earthquake of Bam, through the help of the good Iranian people, we have fundraised and we have established a clinic in Bam in the name of Yaran Mardum Arg, which is Yama, and also in the earthquake of Kermanshah and flood of Shiraz.
Thank you,
we are
Dr.
ready
Jan.
to help them.
Thank you, appreciate that. And Kamya, if you could go over your work as well very briefly so we could start with the material, would appreciate that.
So I am so honored and delighted to be here. So the Institute for International Health and Human Rights aims to protect the right of disadvantaged population to health and to promote the right to education, especially for underserved population, and particularly for internally displaced population. We have projects in more than 12 countries in the Middle East and Central Asia.
Thank you, Kamya Jan. Now, we know that the World Health Organization has declared the COVID-19 or the coronavirus as a global pandemic affecting every nation around the world, including the United States. Regardless of how prepared a nation is for the coronavirus outbreak, disasters of such magnitude require us to come together to intervene with humanitarian assistance to save lives and to hopefully contain the spread of this dangerous pandemic. Iran is among the countries that have been hit the hardest with the coronavirus pandemic. But to understand the scale of this disaster in Iran, I would like to turn to our panelist, Mr. Alai Kamya, to give us an overview of the situation, current situation on the ground in Iran.
So as you know, based on official report, there are more than 67,000 infected cases in Iran and more than 3,000 deaths. But based on a lot of sources that we use, the minimum number of infected cases are more than 200,000. And in some studies done by MIT and other groups in Virginia Tech, there's minimum 500,000 infected cases until March 21st, which shows the significance is huge. And as you know, if a person gets infected, within 3 days, he or she can infect almost 3 more people, and it's exponential, which means if we don't do anything today, maybe tomorrow is too late. And this is the reality. And as you know, there are a lot of countries in the Middle East that the first case which was detected was from Iran. There were more than 12 countries that documented, which means the coronavirus doesn't consider the borders. If we don't do anything in Iran, so there's not just limited to Iran, there's a lot of countries which get affected. And you know, today, even in the United States, is a lot of huge, especially in New York, which today has several people who got infected and died. So the key point today is that everybody get affected, regardless of socioeconomic status. But unfortunately, those who are more disadvantaged, they have less access to healthcare services, or they have limited health literacy, which put them at greater danger. And unfortunately, we see now there is no single city in Iran which is not affected. And unfortunately, due to, I think, lack of leadership, that was the result that there are a lot of people that they are facing the significance in the future. And I hope with the leadership of these distinguished panelists and all the NGOs which are part of this initiative and other new NGOs, we can work together to help the system of healthcare system of Iran, and also we try to reduce this exponential trend of coronavirus.
So, Kamya Jan, for me to understand what's happening in Iran, I wanted to know if we know when the peak of the spread would be in Iran, or if we have passed that peak. And if not so, why is it that it has been prolonged in Iran? Because Iran has been dealing with this
so
for
that's
months now.
That's a great question. Unfortunately, Iran didn't follow any approach, neither Chinese approach, nor European approach, or US approach. And that's the challenge. And there's a lot of controversy among policy makers and experts which approach they should use. Some days they try to say people stay at home. Next day they say no, you have to go to work. So people get confused, and that's the problem. We couldn't get the significance of the issue. And while we know initially it started in one city, home, but later on 7 provinces get affected. And during the past 3 weeks, we had a New Year, celebration Persian New Year. That's 8 million population. They moved from bigger cities to smaller cities, which implies that now we are facing with a huge outbreak in the smaller cities. So I don't expect we are in the peak right now. And if we are facing the peak in the next 2 weeks in major cities, in smaller cities, there will be another 2 weeks delays, which means, unfortunately, because we didn't lock down the entire country, we couldn't control at the same time.
To understand this, the mitigation reasons have not been strictly applied. I think you're referring to social distancing, and also the no-risk travels and visits, which they didn't see a serious limited travel restriction around them. And also what we see is because of the portion of the big portion of the population who earns their wages through daily work, they're at higher risk of transmission in these communities, and that's why very where the peak could come 2 weeks. Now, if that is the case, what are the immediate needs? How are we? What is it that they need right now that we could?
We have, health care providers, nurses, clinicians, that they are at risk of some of the weeks, which means the first priority is to protect healthcare providers and reassure them that they are protected, because even some of the providers, while they are working, they are not sure whether they are protected or they are putting their life. And at the same time, these healthcare workers, when they go home, they bring those infections to their family members, which means not only we protect them, but also we protect their immediate family members. So that's first. Second is to have more testing, because the challenge we have right now in Iran compared to the rest of the world is that we have limited number of tests every day. We used to have 6,000 tests, and now we got to 10,000. But if you look at other countries, they do more than 20,000, 30,000 tests. And in the United States, they do 100,000 tests every day. So the point is that if you want to control the outbreak, you have to move faster than the trend of the virus. And the only way we can do is to have very proactive approach and have early detection. Because the sooner we detect a person who is infected, we can protect the immediate family members. Because 85% of people get infected in their homes. So it's very important to find them and then to backtrack that, say, during the past 2 weeks, whom did you expose to? So by this way, we can identify them in early stage. So testing is very important. Also medication, and that's another challenge, because if we provide medication, we can help them to survive and we can reduce disability.
Thank you, Kamil. So as we said, it has been affected the medical staff, doctors and nurses and others heavily in Iran. maybe the percentages coming out of Iran are higher than other countries. And that's, we're losing talents who have been studying for years and learning this material. Doctors and nurses have become talents that are useful for the society, and we're losing them because they don't have enough is another material they need for their protection. So what I understand is Iran is in a situation that if we do not get in there quickly and help with the humanitarian relief, the disaster is going to be continuous from now on. Now, I want to turn the discussion towards a question that a lot of folks have asked us. Now, we understand that the disaster in Iran is grave, but the real question is whether it is even possible to provide humanitarian relief to Iran. Many in our community are unsure, and I would like to bring into discussion Mr. Eric Ferrari to tell us, to ask him to provide a brief overview of the humanitarian exemption carve-out and the relevant exemption under OFAC to bring in the legal requirements of whether there is a way to help Iran and help Iranian people.
Thanks, Ali, both for the question and for organizing the panel, and to the panelists as well. It's great to hear their thoughts. So there is an exemption with respect to donation of humanitarian articles. I'll get into that in a moment, as well as authorizations to export food, medicine, and medical devices to Iran. There's also an authorization on the books for supporting nonprofit activities in Iran as well. And then there's a broad licensing regime that the Office of Foreign Assets Control, which administers the U.S. sanctions targeting Iran and other countries and different types of conduct, maintains, for which authorization can be sought. So let's start with the exemption. The exemption is actually built into the statute, the International Emergency Economic Powers Act, which underlines not only just the Iran program, but the majority of different sanctions programs. It's then codified into the Iran sanctions program through a particular regulation. And what it says is that exempt from the president's authority to regulate trade it exempts from the president's authority to regulate trade the donation, so keep that word in mind, of humanitarian articles, including food, medicine, and clothing, intended to alleviate human suffering. So as an initial point, we know that what is exempt is food, medicine, and clothing. What's caused some confusion, and which is a little bit of a gray area, is that those are illustrative examples. So what the exemption is really covering is the donation of humanitarian articles or items. So it could be broadly construed, and this is one of the areas where people have been coming to us and asking the question, okay, does this fall under the exemption or not? If you want to take a more restrictive look at it, you would just say, okay, well, we know the medicine is, but what about the medical supplies? Assuming the exemption doesn't cover medical supplies, you move on to the authorizations that are built into the regulations. There's one particular regulation that generally authorizes the export of most medicines. Now, this is for commercial sale or non-donative articles, but most medicines, as well as a large variety of medical supplies. And there's a list of medical supplies that are not covered by that general authorization. So you have that as well as another way that U.S. persons can export or provide, medicine and medical devices to Iran. You also have specific licensing policies, meaning you can apply for a license to export medicines or medical devices not covered by the general authorization. And then finally, you have what's called General License E, which is a general authorization that allows non-governmental organizations to export humanitarian and nonprofit services for nonprofit activities to Iran in certain categories, including with respect to health-related disasters. And there is a limit on that of $500,000.
Yeah, so for me to understand this legalese, I'm going to ask you a simple question. What does that mean in a tangible sense? Can organizations send medical supplies specifically that would help with COVID-19 to Iran?
Yes, they can. The answer is yes. The question is actually whether they are fully exempt or whether they are just authorized, and there's a difference. One is completely outside the prohibitions. One is authorized despite the prohibition. So taking a more conservative view, what you would want to do is take a look at the list of medical supplies which require a specific license. And if it doesn't fall on that list, then you're eligible to export those medical supplies to Iran.
So so we talked about medical supply. Now, if there are medical supplies that could be purchased in Iran, how about purchasing them in Iran and transferring that money there? Is that allowed as well?
So non-governmental organizations are permitted under General License E to export services, and the remittance of funds to Iran is considered a service under the sanctions regime. So a U.S. NGO could send money to an NGO in Iran, and they could use that money to purchase medical supplies for use in Iran. Likewise, private individuals could apply for a license to do the same thing, or they could remit their funds to an NGO operating under their own license or under General License E.
And does that make any difference, or basically what difference does it make for organizations with general license in contrast to the ones who've already received the specific licenses? What does that change anything?
Yeah, it absolutely does. So you got to think a general license is an open authorization, but it's limited in nature. So it's limited either by its amount, the scope of its authorization, so on and so forth, where a specific license is a scope in your application and receive a broader scope of transactions that you're allowed to engage in. So you're not limited by what the general authorization or the general license allows for. And you could do more potentially under a specific license, depending on what you ask to do.
Right. If we already established that there are ways to send medical supplies to Iran and also use funds, now can other organizations that do not have any type of license, general or specific, simply donate or provide a grant to another organization that has such a license, so that organization would provide humanitarian relief in Iran?
So the answer generally, in most cases, is yes, but it depends on whether they're operating under General License E or they're operating under their own specific license. If it's General License E, the authorization is for the NGO to export the services or provide the funds, but there's nothing prohibiting a U.S. NGO from providing their funds to another NGO who then, under General License E, remits the funds. If it's a specific license, it depends on the terms and the scope of the specific license authorization that was issued by OFAC. But the answer is generally yes.
Now, another concern is coming from individuals who want to donate. How about individuals? Could they donate to organizations that are providing humanitarian relief in Iran. I'm basically asking this because some have asked whether they would be doing something illegal if they donate to an organization that's providing humanitarian relief in Iran.
So it depends on the organization. If it's an organization operating under a general license or a specific license, then yes, they can donate to that particular organization and those funds can be remitted to Iran. If they're trying to remit the funds directly to an NGO or some other party in Iran, then that likely would run afoul of the sanctions regulations.
Well, thank you, Eric-Jen, for providing that information. So I think now we have established that the level of the disaster in Iran, and we know that there are channels that organizations could provide humanitarian relief in Iran. Now, I want to move from that and at this point, just cover that we talk about examples of American charitable nonprofits who have already provided relief to Iranian people battling the COVID-19 pandemic. So not only this disaster exists, but then talking about the legal sense, it's possible. Now I want to give you two good examples of organizations who have already been on the ground helping Iranian people against COVID-19. I want to begin with Ms. Delfariq Fanayi, who's the co-founder of Moms Against Poverty. Delfariq Jan, can you give us an overview and then example us what is it that you have already done in Iran in recent months?
As I mentioned, since 2012, we've been working with relief, with disaster relief in Iran. But we have never been faced with such an immense and big disaster before. One of the things, when we found out about this pandemic, this amazing pandemic that we never seen before, we realized the need is too great and it's huge. So immediately we have released, we have since January to now, we have sent over more than $850,000 to Iran. And we have assigned $600,000 just to battle this unprecedented disease that we never ever thought we are going to be faced with. As you all know, we call this a invisible enemy, something that we never ever expected and is global. But unfortunately, we realized soon when we found out how fast it was growing in Iran that this is too major. With other I have to just mention this, Ali John, with the other disasters that we have faced with, we knew what we are dealing with. It means that there was a start, it was an earthquake. Right after we went there, we dealt with the disaster, and afterwards we started rebuilding after the disaster. We helped and then we rebuilt. But this one is ongoing. As Dr. Alaei mentioned, is too major, is too big. So it is necessary for, community to come together, organization to come together to battle this. We have purchased more than 25, equipments. I mean, thousands and thousands of supplies, masks, all the necessity, and we have, provided them not just to the hospital and not just to the, healthcare facilities, even had to actually send them to some orphanages to prevent this disease from growing. This disease is just really, really, really fast growing in Iran. Due to the geopolitical issues that Iran has, as we all know it, we understand that Iran is in a very unique position right now. I mean, Iran is a country that cannot be dealing with the rest of the world, because of, again, due to the geopolitical issues. That's all I can say about this. And that has really, really left Iran alone to deal with this disease. So it becomes necessary for us to come together and really help them battle this disease. And it cannot be done without a proper equipment, without a proper, supplies that has to be redone all the time. I mean, we give the hospitals, but the next week they need it again. I mean, the masks, the protective clothing, you can't just give it once. You have to continue replenishing. So we have to really understand the need in Iran is great. The other side, if you allow me to say that with this disease come other problems with Iran. That, this, I mean, even if you notice in United States right now, we are dealing with disease in one hand and the poverty and the lack of, because businesses are closed, people are out of job, everybody is sitting at home, the social distancing has made us all sit at home. Right now, in Iran, the situation is even worse because we already had economical problem. We already had poverty growing. Now the situation is even worse. And with that, we have to be understanding that when you deal with a disease like this in the hospitals, the next phase is you have to think about the poverty is growing, the hunger is growing. So this is a huge battle that we have been faced with. And the only way, again, with this amazing organization, this amazing coalition that we have put together, HUREC, this is what is needed amongst our community to go to fight with this amazing, this horrible disease that is really going to make a weak country weaker.
Thank you. That's very good. Appreciate that. Next, I want to turn to our other respected panelist, Ms. Gila Kashev, the president of Keep Children School. Gila Jan, can you also provide us an overview and example of what is it that you already have done in Iran to battle COVID-19?
Thank you, Ali John. Actually, even I did mention that our mission was not release actually for the disaster. However, we did have some experience for the children only in Kermanshah and in many locations of Kermanshah and Sistan Baluchistan. However, since this crisis is actually a universal crisis, that is why we could not stop, not to do anything. Then, so we decided we have to be part of this. In order to protect the children, we have to actually contain the crisis at this time. That's why within a short period of time, within 3 weeks, we were able to collect about, maybe raise about $200,000 US from all over the world, US, Canada, European, and also from Iran. We actually jumped in very shorter period, quickly, with the best quality, with the best knowledge that we have in our organization, and also with other doctors we work, delivered more than 350,000 actually, I believe, different items to 25 hospitals around Iran. We delivered to about 14 provinces. And once we were continuing, and then once fortunately this coalition came actually to question, we decided to stop our individual support and come to work with you guys to be more able to have the ability to bring more services to actually to the families, not only to the hospitals. I'm hoping that we will be able to do that. So, of course, our primary service will be to deliver anything that needed by a hospital to protect our doctors, nurses, all the professionals in the hospitals. But as Delta mentioned, the poverty, the hunger, especially in the area that we work with the children, thousands of children that are under our support. We constantly receive a message from Tehran, from our office and Jamani Yaran Danishmamir, we have to do something. Just a scholarship is not enough for these children. About 70% of our children's parents don't have any work, any job at this time, any income. They are actually in the process of hunger. So we have to come also, hopefully, as soon as we're done with the project with the hospital. I mean, even now, we have to take care of our children. We don't know what to do. We are constantly, nights and days, working with Iran to see what would be the best way of taking care of our children as well, next to the project that we are doing with the coalition.
Thank you, Julian. So as I understand it, both of your organizations, Moms Against Poverty and KCIS, have already provided extensive support, humanitarian relief in Iran. And I really thank you for that. In the last 2 months, you guys have been very active. But we get to continue on this road. The reason is, as Dr. Aloy said, this disaster is so grave that we don't know where the end of this tunnel is. And that's why we moved toward creating a coalition. I want to ask Dr. Shukuh Amiri to tell us why we moved toward creating a coalition, what our objectives were, and what is it that we're planning to do.
Thank you so much for the opportunity. And there are so many good humanitarian organizations that each of them could help. But if everybody wants to help separately, the amount of the work and the efficiency and the cost will not be good enough. For that reason, and knowing the magnitude of the problem in Iran, we all came together, created a coalition that we welcomed every association, every organization who want to help to join us. And there were 5 of the core group that started this one. And as you said, now we have more than 20 in United States, and with Canada and Europe, maybe more than 35. They all have the good intention of helping Iran. So this way, we are decreasing the cost and increasing the efficiency, and also the way that the material will be handled to the needed institution in Iran. We have a group that are working in Iran, trusted physicians and trusted people that we have all worked with them for many years. They are representing us and giving us information and reliable statistics that which hospital needs, which city needs, which province needs, and when we collected enough money to buy the things or buy in Iran, we will direct it to the proper place. But it's very important that Dr. Aloy mentioned in the beginning, the magnitude of the people that have been affected. Even though we may not have a very reliable statistic, we know what's going on. And the thing that I received today, that 42 physicians, 16 nurses, and 24 medical related group like the driver or technician, they have died. Think about it. These people did not have the comorbid situation or a risk factor in their life. They were active in their most fruitful part of their life. The reason these people have died, these were the soldiers in the front line of trying to treat and take care of the COVID-19 virus. And they were overwhelmed because there is not enough material, there is not enough bed, there is not enough hospital. So each physician, each nurse, each personnel, they have been taking care of 10 times the job that we do here. If we take care of 20, 30 people, they have been taking care of 300, 400, and they have not escaped from their duty. They have wholeheartedly done the job, and what they have done, they have sacrificed their life. 42 physicians, as you mentioned earlier, it takes time to train them, to bring them to be fruitful, but they lost their life and nobody's escaping. They continue to do the job. As you hear, Mayor de Blasio said that the New York situation is like a war situation. Think about it. If New York, with all the possibilities in the richest country of the world, have that situation, Iran, with all the problem that was mentioned and was discussed adequately, what's the situation there? That's why we created this coalition, and we pray and we ask all the good people, think about it and start donating as Dr. Alai said, that every day matters. The sooner we can send, the better, the more lives we can save. Thank you so much.
Thank you, Dr. Jan. I appreciate that. To add to what you just said, to explain to our audience, we have already a system in place that we have a need and assessment coming in that makes recommendations of which medical supplies or pharmaceutical supplies are at the highest need in Iran. And at the same time, our connections in Iran with the doctors and hospitals are providing us with data, which our scientists on the team are coming up with priorities of regional priorities and hospital priorities that we recommend to send these material to. So the first one, I see a lot of questions on this, whether we work for the government, United States government, or the Iranian government. To be very clear, none of the organization work for any government. These are charitable non-profit organizations, because I see 5 of these questions in front of me have already come up. Charitable non-profit organizations who are working tirelessly for charitable cause. And what we are providing is for people of Iran. We're directly providing them to the end user, meaning the hospitals and the doctors are going to receive these. So before we go to Q&A, I just wanted to mention and thank all the coalition members who have helped us create this coalition and support us. Besides the Iranian American Medical Association, Moms Against Poverty, Public Affairs Alliance of Iranian Americans, Keep Children in School, and Institute for International Health and Education, who have initiated this coalition. We have the Iranian American Bar Association, Pars Equality Center, Iranian American Women Foundation, Southern California, Persian American Medical Association, Child Foundation, Child International, Society of Iranian Psychiatrists in North America, Amin Areste Foundation, Roya Foundation, NEPOC, Seed Medical Magazine, Payam Ashina Magazine, Omid Multicultural Institute for Development, LA and OC chapters of Iranian American Chambers of Commerce, Iranian American Community Information Center, and other organizations came together to build this humanitarian coalition. Now, what we need after this call is we want you guys to leave this call with enough information to know what we are worried about, what's going on in Iran, and also to go out there, get the word out, and also support us. Feel free to visit our website at humanitarianreliefcoalition.com or yarikon.com, which is YARIKON.com. Now, I want to move to ask some of the questions. I know this has been becoming longer than we expected. The first question that was asked here is that I want to ask it from our attorney, Eric Ferrari. There are many Facebook pages set up to raise donations. Are those in conflict with OFAC restrictions? And if someone donates to them, would they be violating OFAC restrictions and sanctions?
So you'd have to look at it on a case-by-case basis to determine who is the administrator of the page, what representation, what organization is being represented, are the donations and funds being provided in line with a general or specific license. So it's difficult to answer that as a general question. You need to really look at the particular parties behind the pages and what authorization they're operating under.
Thank you for that. So another question was, has any of the organization on this call sent anything to Iran for humanitarian relief? I think Del Farjan, Jilajan could very quickly again talk about that.
We have sent, as I mentioned, we have sent more than $850,000 since January, and we have assigned $600,000 of that for the relief work for coronavirus. Gonna let you know that we do have an OFAC permit, and we do have the banking system works with us. We have the whole banking system to send the money to Iran, to our sister NGO, Nidgaman Jamshidi. So yes, we have, and we have done it with $600,000 worth, and we have purchased supplies and equipment with that money for the different hospitals all throughout Iran.
Thank you, Dr. John. Another question was asked
Ali John, I would like also
oh,
to say
sorry,
something.
Gila John.
You forgot
go
me.
ahead.
We just wanted to say also that what we didn't send actually anything from out of Iran except money. So we send the money to Iran. We also raised, as we said, $200,000, but we send much more than what we raised. Like we knew that we are getting more donation from our donors. And we purchased every single items in Iran with the companies that they were actually, the vendors that they're exporting from other countries. And surprisingly, we were still surprised that every single item that we purchased, and we did have someone, a doctor and another person, to quality control our items that we purchased from Iran. And you could almost find everything that we needed in Iran except ventilator. That recently we have found a company in Iran that makes ventilator in Iran. It has been accepted. We could only purchase 4 of them for the hospitals. But other than that, everything was purchased, more than 350,000 items. Everything was purchased in Iran.
Thank you for that, Gila Jan. I understand the needs and priorities change every day, so we have to talk about them as they come. Now, another question was asked whether the donations to the coalition are tax exempt. The answer to that is yes. The organizing foundation of this coalition are based on 501c3 organizations or charitable organizations. Your donations go to our to 2 of the organizations who are the fiscal sponsors of the coalition, and your donation will be charitable or tax exempt. At the same time, the coalition does not have the overhead. We have come together, we agreed to do this on volunteer basis, and we will not charge any overhead. I repeat that, 0 overhead through our coalition. Another issue that I wanted to talk about is, it was asked if I can help. How much money I should help to help one person or one doctor? I think people want to understand and get a better sense of how their help would be used in Iran for the people of Iran. Kamyajan, can you go over that for a minute? Thank you.
So it's very important that each dollar count based on our calculation. If you donate $8, you can save and protect the life of 5 members of a family for 1 month if they have 1 person who has coronavirus, and 5 members of a family of a healthcare worker who is exposed to coronavirus for 1 month. If you donate $12, you can help to have early diagnostic for a person who has coronavirus, which if we don't diagnose him or her, he or she, they can infect up to 400 people within 1 month. If you donate $80, you can save a life, a person who is hospitalized due to coronavirus. And if you donate $200, you can protect life of doctors, each doctor who can work for 20 to 30 years, and he or she can see and save life of up to 100 patients per day.
Thank you for that, Kamyajan. I know there are a lot of other questions coming in, but we promised that our call would be 1 hour, and I want to thank everyone who joined us in this call. And if there isn't anything else that our panelists want to add to that, I want to thank everyone who joined us. If you have any more questions, please feel free to go on our website. I repeat that, humanitarianreliefcoalition.com, or you could access it through yarikon.com, YARIKON. Make sure that you spread the word. Make sure that you donate. This is a fight that's continuous, and we're preventing an unprecedented disaster in Iran. If you have any other question, please go on our website and use our email to send us your question. We'll be getting back to you as soon as possible. I see Delphi and Jilajan want to have a word. Go ahead, Jilajan.
I actually want, oh, I'm sorry, go ahead.
That's all right.
Just wanted also to confirm Kamran John's that every dollar counts. $200,000 for us was not made by 10 people or 20 people. It was made by 3,500 people from all over the world. So it started with the $5. We had a lot of $5 donation. It really made us cry. How it spread it, how worldwide it spread it, this cause. And that's why every dollar counts, Ali John. $5, $10, it doesn't matter, as long as we all feel that we are part of this movement. This is the most important thing. I also wanted to mention that when we delivered this item to hospitals, we did receive clips and also notes, letters from hospital. It really made us cry. How appreciative they were for not little things. A lot of things we spent it, but even for the little things that they received, they are so appreciative. So we really can do a lot with a dollar money that is donated to us.
And Delphi John,
I just
wanted to add
the same thing as John said. We are struggling ourselves. I understand that United States is struggling. We are in a very bad position. But I just want to let everybody know that they have to give generously from their hearts for a country that has been cut off from the world, and they need us. We need to come together and we need to help them. And $12, $8, Kamran Khan, we can do much more than that right now, because we are the privileged people in this world. Right now, we are the privileged one.
Thank you. Kamran, going to get the last word.
So I just wanted to thank all people that they are donating, and I heard a lot of people that they are very generous that started calling for $100,000 match. So I would ask anybody who are ready to match those $100,000, you are more than welcome. And we have more than 1 million Iranian in the US, 100,000 in Canada. If each of them, they just donate $10, it gets $10 million, which is our first target for the first 30 days.
Thank you very much.
Lovely.
I appreciate you being on this panel. We'll be in touch with everyone. Thank you very much. Have a good day.
Thank you so much.
You.
Thank you for that.
Thank you.